Hi, I'm Deb Blood.
And I'm Jim Beagan.
Welcome to Yes We Can.
In the Know About Disability. We're going to continue talking today on the topic of options. And we're going to continue with our guests from our last show, who are Matt Pellegrino, the Vice President of Long-Term Services at the Northeast Independent Living Program. And
Joan MacLauchlan, Director of Clinical Services at First Choice Community Medical Centers.
Excellent. So in our last show, we were just getting into the issue of mass health. And mass health being a very important partner in helping people make these options. In addition, you were talking about grants that are available. That people really have to have a roadmap to find these things.
Yeah, we say at NILP is sort of like navigating the system in a way and teaching others to do that. So I was mentioning how many of the programs that we mentioned in the last show, like the PCA program, the adult foster care program, generally persons would need to be on mass health to qualify for those programs. That's why it's so important. A lot of LTSS, long-term services and supports at home, are covered through mass health, at least for younger persons with disabilities. So that's why it's a lot of our work is helping persons see if they're eligible. They might have used this application form and not submitted a supplement form. I like to say I'm an expert on mass health, but I don't think anyone is. But it's
I can understand.
It's really it's key for someone to be on it. And unfortunately, the state has made it possible for persons that even who are working to qualify into it. I mentioned Mass Health Common Health, where if you work, you can pay a premium to be on Mass Health. And the purpose of that is because many private insurances don't cover things like PCA, like a electric wheelchair, to the fullest extent that it can. So it helps persons sort of remain living at home in the community if they're on it, especially if they have a significant disability.
Do people self-select and say, well, I'm not going to get any help, so I'm not going to look, because they might earn too much?
Yeah, it's possible. It's possible. But, like I had mentioned, there's different ways that they can get on Mass Health. And even if they can't, there's still programs out there. I mentioned the Home Out Loan Program. That is not something that you need to be on Mass Health to take advantage of.
So the thing is to ask.
To ask.
And not assume.
You have to be your own advocate sometimes, because people don't always tell you, even persons in our field, depending on what they know, they might not tell you, so you need to ask for it and not just sort of follow along with what they're suggesting to you. Advocate for yourself.
And what about in your field? Do you have to have people self-advocate too?
Many times. Most of the time, a family member is helping out, and they're able to look into other programs to help. I was just thinking of how it would be very important to know where these programs are, and maybe that starts with the doctor's office, and being able to point them in the direction, because I wouldn't know where to go. So maybe my doctor might be able to give me that information. So I'm gonna bring this back to First Choice, and we can help out, especially with, like you were saying, wheelchairs and things like that. Most of the patients that I deal with are on Medicare.
Okay.
So they are not on Mass Health. So Medicare does pay for a lot of different programs too, but Mass Health definitely has a lot more options to keep an individual at home.
I had mentioned that many of the drugs for multiple sclerosis, which is what Deb and I have, are extremely, extremely expensive, in the hundreds of thousands, $100,000 a year. And when they want you to go on something, you really are reliant on them pointing you to a charity that can help, like the the patient advocates for, there's different funds, and often you have to hunt every year for a new one that has money because they don't all have money every year. So I can appreciate that, and it makes you a little gun shy about looking for things because it's so much work. And that's where you need an advocate to help you get the strength to do it.
Not just that, I think people get overwhelmed.
Right.
They don't know exactly how to go about it, you know? So, I mean, I know I'm very active at my senior center. I exercise. Fortunately, I can go. I go for the socialization and for the exercise. And I want to get an alert, you know, wrist button. So they said to call Elder Services to help me out with that.
Well, let me ask a question. Is all of the work peer counseling one-on-one, or do you do large group presentations that might be helpful to, say, at a senior center or something like that?
We do outreach. Part of the options counseling program is we're required to do outreach with different, either could be nursing facilities, it could be council on aging, it could be just really any organization that sort of has clients or consumers or persons that might at some point become at risk of institutionalization. We do just general outreach as an agency, NALP. You know, either we have a housing workshop going on tomorrow at NALP to teach persons how to conduct a housing search for public or affordable private housing. So that, you know, we try to get the word out as much as we can about what's out there through groups or just through individual work. Yeah.
Should we recommend that people check out the website?
You can.
At nilp.org, is it?
Yeah, that's right.
Yes. And it's important, again, that you take the initiative in finding out what's out there for assistance. Not just assistance, but companionship, as Deb was saying, that going to a senior center is a very valuable thing because you meet people.
It is. But you know what I always say? It's great Monday through Friday. But Saturday and Sunday, there's nothing there.
Yeah.
And that's when people get the loneliest because, you know, people are with families and they may not have families and they're alone. I wish they could get some money for Saturday to keep it open at least one day a weekend, you know. But then it's very costly. I asked the director, is there anything, you know, we can do or anything? She said, it's the staffing, you know, to operate each day. So I was just thinking of that of my senior center.
So I realize that the goal of your organizations is to keep someone at home and in the community independent. What about when you can no longer stay at home, either financially or whatever? What are the options then?
I think some of the options that I've seen is, we were talking about that earlier, is maybe even a group home that you have someone, it could be in a house where there's a group of individuals that are there, but maybe they need someone 24-hour care, maybe just for, you know, it could be transferring or help with a shower or cooking for them. When I worked in the assisted living, and now I still visit them, a lot of times why they come into assisted living is because they don't have either the family support that they needed that can help them with maybe their ADLs, getting dressed.
ADL is...
sorry, I just blanked on that. Activity of daily living.
Okay,
Sorry.
thank you.
And it would be helping them maybe getting dressed or bathing.
So it's a way of sharing the availability and expense of PCAs.
Yeah. So it can be costly. Assisted living in Massachusetts is a social model, not a medical model. So you're paying quite a bit of money to live there, but you have 24-hour assistance,
Well,
security.
then it is a medical model too.
It's assistance. Medical, the way they think of medical is having someone who can do procedures. So if there's wound care or anything like
Okay.
that, that would be the medical part of it.
Okay.
And then they also make sure there's programs that help them get their medication. So you might have all these meds to take, but it's so confusing, there's so many of them, that someone will come in at a certain time and say, it's time for your 8 a.m. meds.
Okay.
And they'll be all set up for them,
Okay.
so that they won't miss them.
Or even if there's a phone call or something to say, get on the ball, take them. I need those.
Yeah.
If they're not on the right table with
And
you.
even at home, if there was a person at home, there's machines out there that you can have it loaded and it will go off at a certain time and drop the meds so that you know to take those.
Wow.
So there's a lot of options out there.
How does someone find out about a group home?
I think it would be the same way that, we've been talking is asking the right people. The groups that you're involved in, it might even be senior center that can, recommend some places to go or people to call. Any of the rehabs that they're at, they might not be able to go home, so a rehab can also make suggestions on alternative living.
Is there a benefit to elderly housing? Because I realize that a lot of elderly people and people with disabilities are lonely. And if you're in elderly housing, you have a lot of people who empathize with you and share the same concerns that you have.
Yeah, I think there's a benefit to it.
Yeah, I think, something we think about at NALP is having persons in sort of a inclusive, a lot of the disabled housing, housing that's accessible to them is located in buildings with that are meant for over 65. So they sort of combine those together, and I know that we've done a lot of advocacy with the state to sort of have more vouchers so people can take those and use them at, regular, apartment buildings that are sort of, that everyone is in, but might have some units that are accessible to them. So I think it's a concern that we, to have someone sort of grouped together, but if that's what that person wants, we try to keep the person's desires in mind when choosing where they are, where they're living.
Sure.
And if like you said, if they believe a group home would be the best situation for them, but generally, we really do push to have persons in the community where everyone else is, especially the disabled population that we work with.
And you're also looking to make sure it's informed consent, informed decisions, which is the important thing, that it's the person's decision themselves.
Yeah, and they might want a friend or family member involved in that. And, I mean, a lot of them do. They ask us to talk to a family or friend, but as long as they're giving that permission, they can definitely be involved in the options counseling. But we try to keep that person, though, involved as always.
Now, we brought up the issue of where else can people look for help. And forgive me if we mention people that you're used to dealing with. We mentioned the senior centers, we've mentioned age span. Also, there's something called Mass Options, which is a part of the Office of Human Services, the Executive Office of Human Services. And you can also go onto mass.gov and search for a particular disability and what resources are available to them. But one thing I will say about that is you get so much information that it's hard to weed through it. And I've got some examples of those that I looked at. And so do you ever get people coming and saying, I looked at this and I don't understand what they're trying to tell me or trying to help me? Do you have to help people sort through the things that are out there?
Certainly. We have, a lot of times our patients, we recommend, I think I was talking about B&A services. So Medicare has a Part B.
Right.
Part of it that once they're done the typical physical therapy, occupational therapy, it can go on. And a lot of people don't know about that and that can take advantage of it. There is sometimes a cost to that, which again, we get into that expensive part of it. But
Sure.
if someone really needs a little bit more time, it's very valuable to
It's
them.
maybe worth getting rid of the sports
Yeah.
channel to pay for
Yeah.
it. Okay.
There's also a senior guide to healthcare coverage for seniors and persons of any age needing long-term care services. It's put out by Mass Health
Right. Mass Health has
and the Health
a
Connector.
directory.
The Health Connector.
Do you get much you call on that?
For what? The
For
PCA?
their guide for
Healthcare.
senior guide for health services, and they make a point saying on it right away that it's for any person of an age that needs long-term services.
Yeah, I mean, I use the mass.gov website a lot. I might be in a minority, but I think it's a good website to find out about programs that are out there. So we actually, along with our partner HSBAN, put out the a resource guide.
The Green Book?
The Green Book.
Yeah.
We sort of changed, as I told you, we changed the name of it recently, but it's really a guide of all different, so you can look up, okay, as assistive technology, you can look up housing and find all the subsidized buildings in the area. So
It's very well organized.
It's something people really find handy. That we partner with our, again, our HSBAN to put that out for both the elderly and disabled resources in the Merrimack Valley.
Actually, you can see it on your website.
I have to check if it's on there now. I believe there's a link to it. But you could contact us if you wanted a copy, and we could send it out. 978-687-4288. So that just we could definitely get that to you.
We, the Disability Commission in Methuen, we have a website that points to a lot of services, and we mention your organization, and we have a picture of the Green Book that if they click on it, they got to the link.
Okay, so I'm sure it's
great.
there then.
Well, I hope the link still works. We haven't tested it in a while.
You know, websites, yeah.
That's unfortunately the way things go. So is there any information on any other topics that you would like to bring up? It's been very helpful what we've
Yes,
got.
what you've said, but I bet there's more.
You know, I would only, I guess I would mention the state does a lot now for persons who are both on Mass Health and Medicare, so they're called dual eligible. So the One Care program and SCO, Senior Care Options, are two programs that are common now for persons who are on Mass Health, and they can receive care coordination through those. So it's sort of someone that could, we actually have staff members who are called long-term service coordinators, and I think on the SCO it's GSSE, geriatric support coordinators. These are persons who can help you sort of work with the managed care organization that's helping you administer your Mass Health to get connected with different LTSS services in the home. So usually when persons are on Mass Health, they complain because they have no real way to speak to them other than the member services line, and then you're talking to just sort of a customer service rep. But if you're on a One Care program or you're on a SCO program, if you're an elder, that care coordinator really comes in handy when can I get this paid for? Can I get this extra service
Yeah.
related to it? So
So
that's
it's a more direct line. You're not going on to the Mass Health line and wait, push this button, then push that button.
right. And the intent of it is to look at the person's individual situation and make sure they're proactively keeping them healthy in the home, out of hospitals, out of emergency rooms. So
Okay, how about you? Is there anything else you'd like to bring up additionally? Joan?
I think just where my level is once that you've been not able to be at home anymore, our service is coming into the assisted living where our patients are, is keeping them, just like you said, out of hospitals. That's the main goal of ours, and being able to treat the well person, not just the sick person. And we
And
have
keeping them well,
keeping them well, which is a harder thing to do than treating someone who is ill.
right?
So our goal is pretty much the same thing, is always trying to keep them as independent as possible, but with some assistance, and keeping them well.
And there's been a lot of information, not just in what you guys have been presenting, but on the slides. As usual, too much information, I'm sorry. And one to show has aired a few times. It goes into the MCTV archive, and you can watch it again and catch all the points you missed. And you can actually stop the slides, hit the pause button and write down what you want, so you can get the important telephone numbers that we've been talking about for both Joan's agency and for Matt's agency. Not just that, but the websites. So there's a lot of information on those slides that take a hit on that pause button and maybe make note of them.
Well, thank you again so much, both Matt and Joan. You gave us so much information. And we want our viewers to watch this and share it with, their family and friends that might be needing this right now or later on are using it themselves.
Or needing it or using it, but realizing that it's something that has to be in the mind all the time.
Right.
Not to worry about it, but to be proactive, right? Because you can't find that page in the book when you're looking for it.
And thank you again, our crew. And thank you, as always, to our viewers. So good evening.
Good day from Yes We Can.
Yes, yes we can.